Hello, everyone. This is Doug Nelson with Precision Neuromuscular Therapy. And I wanted to explore one concept with you that really is sort of at the heart of what precision neuromuscular therapy is all about. As you know, we talk about teaching clinical reasoning so that we're not focused on recipes, but we're really inspiring therapists to be artists, not technicians, in the sense of being an artist is a much more creative process, and we really feel like this work is incredibly creative. One part of that process is this idea of convergent and divergent thinking. So in convergent thinking, there is this idea that someone comes in and you settle on whatever you think is happening with that person, and then everything is about a tighter focus coming through here. So you end up converging on one particular avenue that you're going to treat, and off you go, and then the person's better and life is good. And that's a lovely idea. Honestly, in the office, that doesn't happen that often. I really stress with all of our in all of our seminars and with all the therapists who study with us, also to be thinking about sort of divergent thinking, which is looking at the multiple possibilities that would explain any one symptom that the person has. So in one of the level 2 seminars, we saw multiple people who all presented with foot pain. And when we did that, I think we saw 6 people in a row, all who had foot pain, almost identical symptoms, and every one of them presented with a different reason for that symptom. So if you have a plantar fasciitis protocol, good luck with that. In the clinic, in real life, it just isn't quite so clear. So this idea of kind of convergent thinking is a lovely model. It just doesn't work that well in something that Aristotle called the stochastic arts. And what he referred to in that so many centuries ago was this idea that that it's unpredictable, that anything can happen along the way. And that's part of the richness and also part of the difficulty, to be honest. When you look at really what we're trying to accomplish when we're seeing people to create, essentially treatment is about creating a predictable outcome. When you look at all the possible variables that go into that, oh my goodness, sometimes I'm astounded at how successful we are given the possibilities and the variabilities that we deal with on a day-to-day basis. It's one of those things where people who don't really understand that just look at what we do and it looks very simple, but everything looks simple unless you actually understand it. And body work is certainly in that category. From the outside, it may not look that complex, but the process by which is astoundingly rich and astoundingly complex. So in the divergent possibility, one of the things that we're hoping for is that you think about any symptom presentation that somebody has, you kind of run through all the different reasons that you can think of that might present that particular presenting symptom. And once you come up with that list, then you have some way, and that's what our testing and assessment stuff is, to converge that list down into something a little more reasonable. But you really have to have a wide process first on the front end before you can start the convergence process. Most mistakes happen when someone presents with a symptom that is somewhat familiar to the therapist, and then they'll lock on to, oh, I think it's this because I saw somebody yesterday who had the same thing. That was yesterday. That's not this person. And you have to stay open to all those possibilities. One of the things that I would suggest that you do is when I see someone, even if I think, boy, this really seems to be the issue, whatever it is, I think to myself, okay, I'm going to take that totally off the screen. All right. I'm going to assume that's completely wrong. What's plan B? What's another explanation that would present with the same thing? I can't tell you how successful and how important that has been for me, because there are lots of times when plan A just doesn't work. And when your brain is already set for, if that doesn't work, I know where I'm going next, it's really, really helpful. And there are times when that plan B, that if I take what I'm comfortable with and what I think is the problem and I make it disappear, I'm much more creative on that side. And I have to say, sometimes it's actually referring that client to another healthcare provider, because it's not actually even in the soft tissue domain. So staying open to those possibilities is a really, really important part of the process. It's also part of the richness of this work, that we really are artists every day. The research, all of the work that we do to provide the underpinnings, those are resources upon which you draw, in the same way that the artist has their easel and has the color palette. But when you put that brush to the canvas, that's when the artistry comes in. That's when choices are made. And so we do all the homework, really, and that is being cognizant of the research, studying, working on skill building, to really have all those things at the ready, so that we can sit down with the clients who grace our doorway and create a session together with them that really makes a difference. And again, if plan A doesn't work, we have plan B and plan C and plan D, and we can work our way through the process. And honestly, in healthcare today, that just doesn't happen that much. Too often, and you hear this from clients, they go in to see someone who's like all over this. Oh, I know what your problem is. It's this, this, and this. We're going to do this, and it's going to be fabulous. And then when it doesn't work, and essentially oftentimes the therapist or the practitioner just kind of washes their hands of it, or kind of puts it back on the client. And that's really, really sad. No one benefits from that situation. We actually put the flag down. We stay with the person and say, okay, this is a process, and we're in this process together. This is not something I do to you. This is something we do with each other and together. But and I think in that process as well, it gives the client agency in the process, where they feel like they are truly part of this whole thing. And I think that's one of the reasons why the results are so good. Thanks for taking the time. If you are interested more, just Google Precision Neuromuscular Therapy or visit nmtmidwest.com. Thank you so much for watching.